Hey guys, I am Dr. Bundi, the wellness doctor, and today I'll be talking about the difference between stress and anxiety. So thank you for tuning in once more. Today I want to kind of demystify the difference between stress and anxiety because I feel like a lot of people are having anxiety and they just think they're having regular stress. So first of all, stress is normal. A normal amount of stress, day to day is kind of fine. But if you kind of feel like the stress is impeding your work life, you can't seem to get things done, becoming a scatterbrain, forgetting everything, then you're like, okay, this is a little bit more than stress. So how do you know when stress is getting to a point where you're not coping? First and foremost, you start getting strange symptoms that you never had before, such as heartburn, palpitations. And palpitations is whereby you feel your heart beating. Normally at rest you should not be feeling your heart beating. Something else is that you tend to get headaches and migraines out of the blue. Again, you can start to have symptoms like you're not sleeping as well as you used to. Either you wake up very early, like at 3 a.m. you're up, or you find trouble initiating sleep. So sleep changes. Something else is you find like you're always getting infections, small flu here and there, diarrhea here and there, like your body is just saying, I'm not okay. So that's when you know, okay, I'm stressed, it's getting out of hand. And what I would advise, if it gets to this point, you need to slow down because you can tip yourself off to the side of anxiety. And a few things you can do is the things that you enjoy that, help you take the edge off. If it's going to the gym, if it's getting a massage, if it's taking a few days off at work. Nowadays, burnout is recognized as a medical condition and you can get days off for that. So when you start having these symptoms, slow down before it gets to anxiety. So what is anxiety or generalized anxiety disorder? Now, this is a mental health condition that has to be diagnosed by a doctor. So please stop diagnosing yourself, guys, with anxiety. You have to literally go to a doctor, specifically a psychiatrist, to diagnose you with a generalized anxiety disorder. And in as much as this condition, you can't do like a blood test or a scan to diagnose it, there is a manual that psychiatrists use. It's called the Diagnostic Statistical Manual, with a criteria that you have to meet to be diagnosed with anxiety. And the first symptom is that you have to have excessive worry and anxiety for more days than not for about 6 months. So we're not talking about you being stressed for like two weeks and then, okay, fine, you've got anxiety. It has to be, the symptoms have to have been present for more days than not for the last 6 months. The second thing is that the symptoms have to be very difficult to control. So usually when you're worried or stressed, people generally have coping mechanisms. There are people who will tell you, okay, when I'm stressed, I'll go to the gym and I'll be fine after that. But the kind of worry that's experienced with anxiety is not easy to control. You try everything. You go to the gym, you get a massage, you talk to a loved one. It's not going away. Yeah, so it has to be very difficult to control. The third thing is that you have to have at least 3 of the following symptoms. 1, you just find it very difficult to concentrate. You can't concentrate, yeah? 2, you feel very restless. You can't settle. You're just everywhere. 3, you're irritable. Everything and anything irritates you. It's just, you're always on edge. 4, you have muscle aches, muscle tension, tightness of your muscles, muscle tension. 5, you're just constantly fatigued. Even if you wake up in the morning, fatigue. You take a nap, fatigue, yeah? 6, you have trouble sleeping. So if you've got 3 out of 6 of the ones I've mentioned, including the first 2 symptoms that I've mentioned, then most likely you have got generalized anxiety disorder and you probably need to be seen by a doctor or a psychiatrist to kind of take it from there. So there's anxiety which is also accompanied by some physical symptoms, so somatic symptoms. We have palpitations, sweating, nausea, heartburn, diarrhea, like you can feel a lump in your throat, difficulty in swallowing. So those are some of the other physical symptoms that accompany the other symptoms that I talked about. Treatment options for anxiety, there are several. It just basically depends on the doctor you see. Most psychiatrists will tend to, if you've got severe anxiety, crippling, debilitating, you can't go to work, you can't concentrate, you're not sleeping, then a doctor, a psychiatrist might put you on some medication, and also a good doctor will also put you on therapy, so the two go hand in hand. So I hope it's very clear to you guys now the difference between stress and anxiety, and how basically stress can tip you over to anxiety. And so yeah, I hope you've loved the video. I hope it's been helpful. If you found it helpful, please like, share, and subscribe to my channel. If you haven't, what are you waiting for? Please subscribe. As usual, love and light. I will see you next time. Bye.